Namaskar dosto, welcome to channel Toxicology on Board. Today in this video we'll be discussing another DABT topic, that is radioactive material, how it is affecting your bone toxicity. So let's directly dive into the question. So the question is taken from a ABT recertification examination May 12, 2000. This is the question paper from which, that is part A quiz, from that it is taken. The question is, ingestion of which of the following radioactive material would be most damaging to the bone marrow? So we have to understand that the cells which are undergoing rapid division, no, so in that bone marrow is there where erythropoiesis RBC formation is taking place. These particular radioactive materials, whether it is alpha emitters or beta emitters or gamma emitters, whatever the radioactive elements are there, like uranium, thorium, plutonium, or polonium, or strontium, no, how which particular organ damage they're causing means bone marrow, where the erythropoiesis is taking place. So which out of this also you have to identify which of the following emitters, whether it is beta emitters or alpha emitters or gamma emitters, which are going to cause the most damage to the bone marrow. So the options are, we have option A alpha emitter, option A beta emitter, we have option B alpha emitter, option C we have gamma emitters, and option D we have those with highest energy regardless of type of emission, whether it is alpha emission, beta emission, or gamma emission. Energy is going to identify this particular type of damage. Or it is option E. Option E is nothing but elements of medium Z atomic number, since their radiations have the most favorable to mass ratio. Okay, atomic number by mass ratio will be there. No, the right answer will be in the green text, that is nothing but your alpha emitters. So alpha emitters are the emitters out of beta or gamma or other type of emitters which are the most damaging to the bone marrow. So in that, will let us understand this particular concept with respect to this question. The ingestion of this alpha emitting radioactive material that are chemically similar to calcium, because the major thing is that whatever this thing, radioactive elements are there, no, their structural similarity is similar to that of either calcium. Maybe they are falling into the same periodic table, if you see in the same class, I guess. So if you look into this one particular radium 226 as well as strontium 90, no, they are similar. The structural similarity is similar to that of the calcium, because of which, no, our body deceives. It will take instead of calcium this strontium as well as radium 226. It will go and bind to the bone, because of which at the nearby vicinity of this bone is there no bone marrow. That particular cancer will be taking place. So the ingestion of this alpha emitting radioactive material that are chemically similar to calcium would be most damaging to the bone marrow, with radium 226, Ra226, and strontium 90, Sr90 being particularly hazardous. These two important things you have to remember. So this you can see here: alpha emission, beta emission, and gamma emission. Okay, so what are the major adverse effects which are caused by this particular thing is that accumulation in the bone. This, no, as I told, no, our body, it will treat these elements, radium as well as strontium, similar to that of the calcium. So instead of calcium getting incorporated directly into this bone structure, this radium and strontium will go and become a part of this bone. Okay, in the bone formation also, no, you have hydroxyapatite crystals. Calcium will be involved in this mechanism of formation of this bone, no. So in that place, instead of calcium, your radium and strontium will go and bind close to the sensitive bone marrow. So in that way it is affecting your erythropoiesis also. Okay, so what is this in third or fourth option we had something with respect to energy radiation, no. So we'll see that particular thing also here: localized high energy radiation. So we have alpha emitters. These alpha emitters, no, like radium, they will deposit a large amount of energy in very short range. Okay, there is a wavelength will be there when you look into these particles, no, in a very short range, that is less than 0.1 millimeter, causing an intense localized damage to the nearby living cells and DNA. So if this radium will go and bind to the bone as well as the nearby vicinity, that is bone marrow, it will cause intense damage, okay, within the short range. Coming to beta emitters, no, they are widely spread. So if you see, like strontium 90, no, they are more penetrating. They have more less intense energy is there, but more penetrating power is there. So because of which, no, the more penetrating power than alpha particles, but less damaging to the living tissue. Why? Because they are widely spread, and because of this, no, energy dissipation takes place. Tissue per unit of energy, damaging to the living tissue per unit of energy, because their ionization energy is more widely spaced. Okay, so however, this prolonged residence time in the bone due to their chemical properties causes significant bone marrow suppression, which can lead to cancers like leukemia, blood cancer, as well as bone cancer. Okay, why this prolonged residence time in the bone? Because the half life of this particular radioactive elements, no, it is in thousands of years, hundreds of years. Okay, so once even a single exposure is taking place, that particular radioactive element will remain in your body for thousands of years, hundreds of years. Okay, so their after effects will be more after certain long duration of time also. Okay, then next one is irreparable damage. So what are these radioactive materials called? Causing high concentration of radiation in the immediate vicinity of this bone marrow can overwhelm the cell repair mechanisms, leading to cell death as well as cancerous mutations. Not only that region, as a nearby region also, it is going to, and it is going to impair your repair mechanism, because of which there will be either the death of that particular cell, or there will be cancerous mutations will be taking place. Okay, difficulty of the treatment. What are the challenges to the physician in the treatment is that once incorporate into the bone, once this strontium or radium they go and bind to the bone, no, these materials are very difficult to remove, resulting in long term internal exposure. Okay, either even though it is a single exposure is there, they will remain in your body for a long time because of that longer half life. So what are the specific emitters we will see? One is radium 226. In our option is also we have considered universally fatal. Exposure to this particular is it might lead to death in even in microgram quantities once ingested, because it behaves exactly like calcium. So radium, calcium is there, body will not be able to differentiate. Instead of calcium, radium will go and bind and delivers a high dose of alpha radiation to the bone. Intense damage will be taking place adjacent bone marrow over a long period, because the half life of this radium 226 is around 1600 year. So remember this one. And coming to strontium 90, which is a beta emitter, the major health concern whenever you ingest the strontium 90 is that it will readily incorporate into your bone, become a part of the bones. The calcium hydroxyapatite structure will be there, no, that and teeth, and causing cancerous of the bone marrow and surrounding soft tissue. Okay, coming to other type, instead of in our options we don't have we don't have plutonium as well as thorium, so we will read about that also in this video. Other heavy alpha emitting nuclei can also be very radio toxic if absorbed into the body and fixed into bones, and it also causes liver for a long time. So that is nothing but plutonium as well as thorium. So if possible, try to remember about this radioactive numbers. Okay, what are those numbers? Strontium 90, radium 226, all those numbers you have to try to remember. Okay, in the options you might get. So in addition to that question, in this video, we will learn from the Clayson 9th edition only. I have taken from chapter 25, page number 1263. In this table, they have given table 25.4. What they have given is that they have from this particular agency, International Agency for Research and Cancer, IARC is there. This agency, it will identify the chemicals which are causing this cancer, and they will certain time they will do some cancer studies also. IARC will give some classification to these chemicals, probable carcinogen, class 1A, class 1, 2A, 2B, something like that classification will be there. So in this particular chapter, they have given listed on this IARC, tumor sites with sufficient evidence of human carcinogenicity they have given. So hope if any question comes from this table, we will be able to answer in the exam. So I have put this table here. Let's very briefly go through this particular table. We have radiation type, major study population, and tumor sites and types on which the sufficient evidence is based. So first one is alpha particle and beta emitters. In that we have radon 222 and its decay products. So what are the major study populations in which this particular has been studied: general population, that is residential exposure, underground miners, those who are mining on certain minerals, no, those. And for them you will be getting this tumor will be lung. Okay, then you have another thing is radium 224 and decay products. Here the population in which it has been studied is medical patients, and the tumor sites were found in bone. Coming to another thing, that is radium 226, radium 228 and decay products, in which radium dial painters. So one video on radium dial painters I have already uploaded in my channel. There you can see that bone, paranasal sinus and mastoid process. This is very important. In the radium dial painters, no, the jaw has been, there was damage to this particular mastoid process was taken place because of the deposition of this radium 226, so in this particular region. Then we have thorium 232 and decay products, where medical patients are the population in which it has been studied, and it will causes liver, extrahepatic bile duct, gallbladder and leukemia, excluding CLL. CLL is nothing but chronic lymphocytic leukemia. Then we have thorium 232 and decay products. Okay, sorry. Next we have plutonium. Plutonium, we have those who are working in this plutonium production workers, no, and the damaged part is lung, liver and bone. Coming to phosphorus 32, we have medical patients in which it is phosphorus 32 is used as for the treatment purposes. There you can see that acute leukemia, blood cancer is there. Fission products are there, like including part is strontium 90. In that the population is general population following any nuclear reactor accident takes place, no, at that time this particular strontium 90 will be released and they will cause solid cancer and leukemia. And we have radioiodines including iodine 131. This you read with respect to that one one important nuclear accident took place. But in that you can say children and adolescents following nuclear reactor accident. The major organ which has been affected is thyroid. Coming to X radiation or gamma radiation, we have atomic bomb survivors, medical patients in which in utero exposure has taken place of offspring of pregnant and medical patients and of atomic bomb survivors. So various things you can see, that salivary gland, esophagus, stomach, okay, all this the multiple sites in utero exposure is also causing this kind of damage, uh, particularly X-ray radiation and gamma radiation. Coming to solar radiation in general population, it causes skin, BCC. BCC is nothing but your basal cell carcinoma. SCC is nothing but your squamous cell carcinoma and melanoma. Okay, and UV emitting training tanning devices, we have skin, melanoma and eye, that is melanoma, particularly choroid and ciliary body will be taking place. So emitting tanning devices are there. So hope from this video you were able to learn about this particular radioactive elements, their toxicity. Okay, so any question with respect to any of this table, you will be able to answer in the exam. Okay, all the best for your exam. Thank you so much. For any questions, you can always write a mail to arya.priyanka18@gmail.com. Like, subscribe, and follow my YouTube channel Toxicology on Board. Thank you.